Good afternoon, everyone, and thanks again for joining our webinar today. I'm Liz Fernandez with VS Training, and I'd like to introduce Dr. Kevin Dennison, who is our speaker today. Dr. Dennison is the Acting Director of Emergency Management, Safety, and Occupational Health for USDA APHIS Animal Care and is based in Fort Collins, Colorado. Among his current responsibilities are supporting ESF 11 and FEMA nationally on animal emergency management issues, coordinating Animal Care's Regional Emergency Coordinator Program, and serving on the advisory team on Environment, Food, and Health, a multi-agency federal team that provides protective action recommendations in nuclear or radiological incidents. And with that, I'm going to turn the webinar over to Dr. Dennison.
Thanks, Liz. I'm very happy to be here today to share some of what I've learned. And Lori Miller and Arlene Buchholz and several people on the working group on mortality management for the National Training and Exercise Program and VS, we engaged in a conversation about, could we do a presentation pertaining to radiological incidents? And then we decided that chemical incidents actually fit in the same type of category of things that we don't often get asked to do. So with that, I'm going to jump into the presentation today. What we want to do is provide some examples of chemical or radiological incidents that have impacted animal agriculture, describe an array of state and federal authorities and capabilities that have to be engaged to manage contaminated livestock or carcasses, look at the multi-agency coordination that's necessary to create incident-specific plans pertaining to chemical or radiological incidents, and then discuss the selection of carcass management disposal methods within the context of chemical and radiological incidents. One of the most fulfilling things I've done in my career with APHIS since 2008 is became a member of the advisory team for Environment, Food, and Health. And during the Fukushima incident, they felt they needed some additional veterinary medical support and someone who could provide some additional expertise related to pets and other animals. And so I joined the team and have spent the last 10 years developing my knowledge of radiation physics as well as radiological emergencies. And the advisory team for Environment, Food, and Health is made up of CDC, EPA, FDA, and USDA as permanent members, and we work with the FEMA and other federal partners in providing consistent, cross-reviewed protective action recommendations pertaining to radiological incidents. We also integrate with the Federal Radiological Monitoring and Assessment Center, which is also a multi-agency organization that helps develop the data products that are used within a radiological incident. So if we look at radiological incidents first, they can be small-scale industrial or medical accidents. That's probably the most common, and we don't often get engaged with those on a national level. They're typically locally managed. Nuclear power plant accidents are certainly a big concern, and the FEMA Radiological Emergency Preparedness Program was instituted shortly after the 3 Mile Island nuclear power plant accident, and it has really brought a systemic support system for community and local planning pertaining to nuclear power plants. And we get involved in those quite often. In fact, I'm going to one in Nebraska next week, and I've actually done 3 others, supported states on 3 others already this year. Everybody's been trying to catch up after these exercises were delayed because of COVID-19. There's terrorism or intentional acts, including a radiological dispersion through an explosive device or perhaps a passive dispersion through food or feeds, and an improvised nuclear device, typically thought to be about 10 kilotons or less, which would be slightly smaller than the ones used in World War II, but nowhere near as large as a lot of the military weapons. We did cover a NASA launch earlier this last year for the Mars lander because it had a fairly large plutonium-238 thermoelectric device on board. And one of the greatest things I think in my life was sitting there listening to the live launch feed on the advisory team's channel and watching a perfect launch in every way instead of all the bad things that we had potentially planned for. And we've also had some, at least some knowledge of the legacy radioactive pollution that was seen from a lot of the Cold War facilities. So do a couple of nuclear power plant accident examples, and to do a couple of the recent ones, the first one I want to talk about is the Fukushima Daiichi nuclear power plant accident in 2011, which I think everybody remembers pretty clearly, secondary to an earthquake and tsunami, lost their primary power, their backup power, and their external power sources when they were trying to shut down, and wound up overheating the cores due to lack of being able to circulate enough coolant, and breached all containment in 3 of the 6 reactors. And if you look at a map of the incident, this is if we look back at that earlier slide, you see a nice crisp model that the National Nuclear Security Information made based on their aerial flights that they did for the Japanese, and it's pretty clean. You can see a lot of variation across the immediate area. But if we look at a soil map later in Japan, you can see that it's actually quite complex. And this is the one on the left is the island of Honshu, the main Japanese island, and the cutout to the right is that right around the nuclear power plant. So it has some similarities to the previous map, but you can see that it's a very complex system of soil mapping, and the impacts to agriculture were pretty complex as well. We look at Chernobyl, and the reactor 4 of their 4 reactors essentially exploded after a exercise that went badly and contaminated a great deal of land in Eastern Europe, actually all of Europe and some of Asia. And if you look at the soil map, which I think was about taken 10 years later after Chernobyl, you can see the residual contamination of cesium-137 is really complex, going up into Scandinavia, into northern Great Britain, and it really had widespread impacts on agriculture, not only through the exclusion zone close to the reactor in the Ukraine and Belarus, but also up into many other countries. So they can be very large, they can be very complex. And we look at a nuclear power plant exercise, and I've taken out a lot of the names of the counties and stuff here, but the symbol, the radiation symbol is where the nuclear power plant is, and then you have this plume that shows areas of concern for iodine-131 and cesium-137. And those are based on projections, based on an aerial flyover, some ground measurements, and then using some models to come up with these areas of concern. And in this particular map, it was an area of concern for milk products. And it's calculated using the assumption that the radioiodine is deposited on the grass and the forage, that the cows eat it, it goes into the milk, and then it goes to an infant. And so use the most restrictive, most extreme exposure. And so the one thing we have to watch out is that people understand what these models and maps are based on. And so this model doesn't really work for beef cattle on pasture. They don't work for dairy cows that are actually on dry lot and not on fresh forage. They don't work when trying to analyze crops, for instance. So the same thing. We have a very complex incident. And if you look at this particular slide, the two circles are 25 miles and 50 miles. I think in this exercise, the evacuation zone was less than 10 miles. So the majority of the agricultural area of concern is not evacuated, which means if people don't have to leave, the responders really don't have to take extraordinary precautions at all in working in that non-evacuated area. So I think some people get really wrapped up in the, quote, hot zone, but for agriculture, there's a great deal of the zone that is not even restricted as far as the access. And in this particular state, they had a great GIS system for their agricultural producers. Some states don't have quite this level of detail, but they could show you where all the various types of farms and animal livestock production units were. So we'll go to the next slide, and we'll talk a little bit about chemical incidents. If you've ever had a copy of the Department of Transportation's Emergency Response Guidebook, you can get that online and put it on a cell phone. And when you're driving down the highway, assuming you're riding shotgun and not driving, you can actually look up the codes on the tail end of the tankers and see what it is they're carrying. And while mostly you'll see gasoline and diesel fuel, sometimes you see some things that are considerably more interesting. But there's a lot of different chemicals in use around the world. There's some of the terrorism agents. They can worry about nerve gas, blistering and choking, phosgene, mustard gas, blood agents like cyanide. But there's also a lot of things that are just toxins and carcinogens that aren't really weaponized. They're just there for potential accidental exposure. Accidental, when it comes to livestock, the primary historical source of chemical incidents in livestock has been feed mill accidents or intentional contamination. There also could be petroleum-related contamination on the water and on the land. Could be industrial releases. I know there's a place in Missouri where there's so much dioxin contamination in the soil that it can't be used for agriculture. Could have transportation accidents. We've seen some where chlorine tankers on rail were disrupted. And then secondary natural disasters. I was, during the Colorado floods in 2012, I was receiving the EPA situation reports, and I can't remember the exact number, but it was, I think, between 5,000 and 10,000 containers that EPA had collected from the flood area. They ranged from aerosol cans with the labels gone up through propane tanks that have been floating down the river. And of course, we'll talk a little bit more about the livestock feed contamination as a terrorism incident. When we looked at examples of chemical incidents involving livestock, the one that really, really rises to the top as far as significance in the last few decades is the Michigan PBB incident. And if you look up Cattlegate on the internet, you'll find a number of different YouTube videos related to this incident that are really worth watching, just to understand how big and how complex an incident like this could be. So PBB is polybrominated biphenyls, and it's a fire retardant that used to be in use. It no longer is. It's been replaced by the PFAS, but now a lot of the PFAS compounds that they use for fire retardants have been found to have a lot of long-term persistent side effects as well. Anyway, this feed mill in Michigan, a large feed mill, received a shipment of what they thought was magnesium oxide to incorporate in livestock feed. In reality, a very similar looking chemical made up of PBB was shipped instead. And so it was incorporated into poultry feed, a lot of dairy feed, and shipped out and widely distributed. It took about 8 months to determine what was going on. A lot of the dairy cows became very ill. Their hooves grew out very strangely. Their milk production dropped. And through the efforts of a local veterinarian and several dairy farmers, they eventually identified what was going on. The problem is that by the time it was shown to be this, many, if not most, Michigan residents had already been consuming contaminated meat and milk products. And so there was a really big, complicated incident. There was a lot of human health impacts, and they had to dispose of all the contaminated animals, which primarily from a bulk perspective was dairy cattle. And over 30,000 dairy cattle were destroyed and buried in a large site in northern Michigan. And they continue to manage the health impacts today. There are still people who were exposed to it who continue to have medical issues and monitoring pertaining to this exposure. Like I said, it's really worth looking at some of the publications on this, because it's such a wake-up call that how bad an incident like this could be. This is a few pictures from their burial site, and if we go, I did find an article that had a great set of maps pertaining to this incident, and so the animals were brought in live to this stockade at the bottom, where they were killed by gunshot, and then taken to the two different burial areas. There's a good cross-section diagram. It's not the scale, but it shows that there's a 3-foot layer of cattle at the bottom of a 15-foot pit. They were covered in this dry sand, and then it was capped with a soil, a deck-type soil. At the way underneath this dry sand bed, there was a layer of silt and clay that they thought would protect it from this PBB going down through the dry sand and then getting into the water table. And then there were multiple multiple sampling wells drilled around the area to sample for any PBB contamination of the groundwater. So it was a pretty well thought out process. I have no idea how that would go today, but they continue to monitor this site, and I guess it hasn't been a long-term environmental problem as far as I know. There are a couple of other incidents that are worth mentioning. In Wisconsin in 1996, there was a intentional contamination of livestock mortality that were being shipped to a rendering company with chloridane, which is a persistent, fairly toxic insecticide that's really not in use anymore. And the feed that was created from that rendered product, this I think was before the ban on mammalian products and mammalian foods, and it was distributed to a lot of farms, including many dairies. There followed a contamination of poultry products for rendering with a fungicide, and then the person was caught, and it turned out to be a competitor who was trying to damage the other business, which is kind of a sad thing. In Belgium in 1999, they also had a pretty significant issue in that they realized that rendered fat for poultry feed had been contaminated with dioxin, which is a very toxic chemical. It's not only toxic directly, but it's also a carcinogen. And they never did determine the source of it. And because of the uncertainty and the concern about European livestock products, many companies banned EU food products for a year, and it cost a lot of the producers in EU about $1.5 billion in exports in U.S. dollars. So a huge, huge incident. And I did want to not mention Deepwater Horizon. It was the largest marine spill in history and had multiple impacts, the environment to fisheries, wildlife to economy. It was really, really a tough incident for the Gulf Coast. At one point in time, I remember that there was a tropical storm with concern of becoming a fairly significant hurricane coming through that area. There was concern about oil being picked up off the coast and brought inland to cattle pastures. And I think there was several discussions between states and APHIS about how that type of a situation would be managed. Fortunately, that didn't really turn out to be the case. Oil never was brought in. It was a tropical storm and much less intensity than was feared. And just to mention how complex chemical incidents can be, the Coast Guard was the lead federal agency for Deepwater Horizon. EPA obviously has a lot of authority on hazardous materials, but FDA also has a lot of authority pertaining to livestock feeds. So it often is a complex array of federal authorities, and we'll see more about that in the next few slides. So when we look at agricultural roles in chemical incidents, I think anytime we start planning for these, we really need to look back at some of these previous incidents. We also need to look at the Defense Production Act and the Stafford Act. And the Defense Production Act is an older piece of a law, but it's also was used very recently in COVID-19 pertaining to being able to increase production of critical supplies for biosecurity at hospitals and other locations. And the president has pretty vast authority pertaining to a lot of different sectors, including agriculture, should there be a really impactful national emergency that really threatens our critical resources. And in the Stafford Act, the president has huge powers in that one, too, to direct federal agencies. And we'll talk about some of the USDA delegated authorities, I think, in a coming slide. And the response, it could be intentional or accidental. It could be a Stafford Act incident versus a non-Stafford Act incident, like the Cattlegate and the Deepwater Horizon were non-Stafford Act incidents. In fact, the Cattlegate preceded the Stafford Act. There's One Health aspects, because not only do we have agricultural concerns, but public health concerns, environmental concerns, they become very complex. A lot of times there's industry engagement with agriculture and external industries to agriculture because they may be potentially responsible for the initial hazard. And then there's a lot of questions about laboratory capacity. While USDA has some great biological capacities, we don't have an in-house radiological capacity and typically rely on the Food Emergency Response Network laboratories for radiological measurements. When you look at chemical or radiological incidents, they can be pretty complex, but they are managed under the National Incident Management System. Incident command is used, the coordination centers of the jurisdictions involved. There's typically a lead state, tribal, territorial, and local agencies, a lead federal agency, and a really large number of coordinating and supporting agencies. I think in common between these and biological incidents is the critical need to use science in hazard-specific approach. And I did mention the One Health considerations, and I think that's so important in these. And we saw from COVID-19 and the CDC One Health Federal Interagency Coordinating Committee and how well that worked, and I think that's the type of thinking we're going to need for one of these. All incidents start and end locally, and so we have to always respect that local emergency management and then state are going to be in there first, and federal agencies come in to support. And with the advisory team, the one thing we always stress is we're there to make protective action recommendations. We don't make decisions. We don't tell state and local jurisdictions what they have to do. And if we look at these types of incidents, I think there's some commonality, but there's some really key differences. In biological hazards, we think about disinfection or degradation of some way of the infectious material. In chemical incidents, we might be able to neutralize or somehow degrade it or get it to redistribute, such as an aquarium plume. Eventually, the plume dissipates to a non-toxic level. In radiological incidents, we have radioactive decay plus redistribution, but we can't really destroy the radioactive materials. The one good thing about chemical and radiological incidents is they don't tend to move all over the country. In other words, they tend to be localized, although with a feed incident, it could get distributed over an area that could be local or perhaps a state. The one nice thing about radiological incidents is we can do on-site detection. In other words, you can do a flyover with the aerial monitoring system, and EPA can tell you what the NNSA can give you an aerial view of where the radiation is at the moment. You can send people out with a hand meter, and they can tell you what the actual background radiation at that site is. A lot of the food has to be detected through a laboratory diagnostics because the levels may be so low that you need laboratory level accuracy. And in a biological incident, there's not generally a responsible party. In other words, we can't pin the incident to a particular entity or company. So, and in chemical and radiological incidents, that may be the case. So when we look to USDA, and first I'd recommend to all the state participants, it's good to go back and review your state authorities as well. Does your state animal health officials and Department of Agriculture, what specific authorities do they have pertaining to radiological incidents and chemical incidents? And if that's not going to match what you're going to be asked to do, then you'll either need to operate in the governor's general emergency management authorities under that umbrella, such as we would in the federal sector under FEMA's authorities, or you need to be able to go to the legislature and look at the possibility of adjusting whatever authorities are needed. There is a USDA radiological response plan that's not been widely distributed. In the APHIS Veterinary Services, the Animal Health Protection Act, the Secretary has the authority to define disease, but radiological hazards and chemical hazards are never specifically mentioned. And you look at FSIS, they have several broad authorities, but their overall mission is to prevent the entry of adulterated food into the human food chain. And if you talk with FSIS, they will tell you that any food that's contaminated above the FDA-derived interventional levels for food, the established safety limits for food, that would be considered adulterated. And obviously, if there's a chemical contamination, there'd be a level that which above it would be considered adulterated. So the other interesting thing about USDA authorities is under Code of Federal Regulations Title VII, Section 2.80, there's a statement in there where the Secretary of Agriculture delegates authorities pertaining to certain aspects of chemical and radiological incidents to the APHIS administrator. And I don't want to go into a lot of detail on this because I think we, within APHIS, need to take another look at that and just decide what exactly it is we need to do to be consistent with the CFR. The Stafford Act has broad authorities, and it allows the president, and FEMA is the delegated federal agency to act for the president in emergencies. They can direct any federal agency with or without reimbursement to utilize their authorities and resources granted to it under federal law. And so it's pretty sweeping. And so even if you find situations that are not what we expected, such as pandemics or radiological incidents of a large scale, FEMA can direct federal agencies to use their capabilities to support that incident. And as an example, during the pandemic here recently, APHIS itself, I think, deployed over 500 people to support federal vaccination efforts. And USDA, from other parts of USDA, deployed a lot of people as well, but I just don't have those figures. And to be fair, there's a lot of federal agencies who did just that kind of thing. I think we just have to remember that if it's something that's outside of our planning experience, we still may have capabilities and expertise that can be applied to it. And with the federal agencies, that's through the Stafford Act. If you look at other federal agencies, you've got EPA obviously has a lot of authorities pertaining to hazardous materials. The Nuclear Regulatory Commission is responsible for the on-site response at nuclear power plants. HSPD 9, which is currently being revised, really has broad directives pertaining to protection of food and agriculture. And then we have the National Response Framework, in specifically the Nuclear and Radiological Incident Annex and the Oil and Chemical Incident Annex, and just a lot of other agencies with their own internal plans. But there's a lot of framework out there for how to address incidents, even if it's an incident we haven't really seen before. The Oil and Chemical Act Annex, this is what ESF 11 says, which is really just the two of the key missions within ESF 11. And then there's a statement about APHIS and FSIS together in the Oil and Chemical Incident Annex. And they're very, very broad. And when you look at the Nuclear and Radiological Incident Annex, and they talk about USDA roles, sample collection, assessment of damage, support and advice on animal decontamination, food safety, and then also the planning and operational aspects of animal carcasses disposal. And if you look at the Nuclear and Radiological Incident Annex, I think it may be the most complicated annex there is. The lead federal agency varies with the type of nuclear or radiological incident. And all of these different agencies listed can be the lead federal agency. So if that doesn't blow your mind, I don't know what will. But there's one agency you don't see there, and that's USDA. And so I think that's the point here, is we need to support whoever the lead is for that specific incident. And I did mention both the FIRMAC and the advisory team as being multi-agency organizations that will support essentially all nuclear and radiological incidents of significance. And I think the fact that they realized that both these elements had to be multi-agency teams in order to provide the adequate support is a lesson to be taken by the rest of the response, that multi-agency collaboration has to be the norm, that One Health is absolutely critical in these situations. So for USDA Resources, we have the Radiation Protection Branch of the USDA Office of Homeland Security, which is the office that oversees the advisory team on for environment, food, and health. APHIS, we know what kind of resources we have for animal health and plant health and wildlife incidents. And really, that basic expertise can be applied to chemical or radiological incidents. FSIS, the Farm Service Agency has some indemnity programs, including one that's specific to dairy farmers and radiological incidents. And NEFA, and I could just go on with all the different USDA agencies that could potentially bring something to a radiological incident, but again, never is the lead. Other key partners and stakeholders, obviously the responsible entity is going to be important. Producers, processors, distributors, retailers, consumers are all going to have some impact on this, on the incident. We have the FDA-derived intervention levels and safety levels for radiological incidents, but if the distributors and retailers and consumers are going to be have high concerns, we have to be able to communicate the actual risk. And while we may scientifically have the incident under control, if we don't do appropriate risk communication, it may look like things are out of control. The veterinary community, academic partners, mental health professionals, because these can really, really impact producers severely, and then non-governmental organizations. And just another complex slide, but when you think of One Health and the interagency approach to mortality management, we have a lot of things to consider. And everything from worker protection to the nature of the hazards, how funding occurs, how is indemnity going to be paid? In an animal health emergency, there's a process that we've unfortunately had to practice a lot the last decade on how to go through appraisal, indemnity, and paying people. But a lot of those systems are not in place for chemical or radiological incidents, and the question is, how is that going to work? So I don't want to go through all this in detail, but there are huge challenges that require people to work together extensively, and probably a lot of incident-specific planning to address some of these critical issues. So I want to go through an example of interagency coordination, and this came from Vibrant Response nuclear detonation exercise in 2014. And several of us from the advisory team were in Indianapolis, and there was a notional request to FEMA for assistance with livestock mortality management in the downwind plume area, which I think that area was about 75 miles long. And so it incorporated a large number of producers. And FEMA asked for a recommendation on the mission assignment from USDA members of the advisory team as well as ESF 11. And I just want to run through some of the elements of that. So the authority would be a FEMA mission assignment. So working under that broad Stafford Act authority. They wanted to have Indiana Board of Health and APHIS Veterinary Services be the leads for the task force, that CDC, EPA, Department of Defense would all be as part of the task force, Department of Defense, the Army Corps of Engineers has a lot of equipment and a lot of expertise in things like soil and water, et cetera. And then they thought that the National Guard would also be useful in doing, trying to identify all the locations where animals were. And then the equivalent state agencies, of course. The priorities were to determine the depopulation area, which would be a fairly significant analysis of actual soil levels and moving from a model to an actual map, looking at types of production, looking at types of animals. The crops were a little less time critical, and they felt that the non-food animals, the companion animals or pet livestock were probably not going to be covered under the mission assignment because they didn't represent a real food-related public health crisis. And the indemnity question kind of brought everybody to a halt. And the question became, how would you pay indemnity to the producers for the animals you destroyed? And FEMA said they would have to get with their attorneys and attorneys from the USDA, and I think it would be a very high-level decision within the U.S. government as to how that proceeded. So I'm not too worried about that particular issue because it'd be solved way, way above my level. Task force operations were to assemble, train depopulation disposal teams. Obviously, there'd probably be a lot of contractors in use. Radiation monitoring and personnel, materials, and equipment, and perform that depopulation and disposal, and then provide decontamination for the people, vehicles, and equipment used in the evacuation zones. And I just put a picture up of the carcass management dashboard at APHIS just because all the tools in that dashboard could be adapted to this type of incident. And I think that it's not something we do a lot of planning for because it's such a difficult scenario to even think through. But I think we're better equipped for this type of situation than maybe we initially think. When it comes to carcass management methods and chemical and radiological incidents, one of the decontamination methods that we could use, and it's not really a mortality management method, would be to hold animals on clean feed and water. If you have animals that were exposed to radioiodine, such as beef cattle, it's gone in 60 days. And so could we not just hold them on clean feed and water and they'd be fine? In Great Britain and Scandinavia, what they did is they took animals off those pastures for a period of time, typically a couple of months, put them on clean feed and water, and the cesium-137 has a very short biological half-life. And literally, after a couple of months on clean feed and water, they could go to market. So we don't want to discount the idea that we might be able to take and use clean feed and water and potentially some certain medical countermeasures to reduce radionuclide levels in animals to where they can either be returned to service or disposed of as non-radioactive waste. And it just depends on the hazard and the biological half-life, the actual half-life, and the environmental persistence of the hazard. So that's one of our methods right there is not being too quick to kill everything. Other categories of things, rendering, it's really probably not going to be an option for persistent contaminants. Maybe for a few things that have very little persistence. And even then, the rendering industry would have a problem with being able to market a product, even if it was scientifically safe, there may be a lack of acceptance of that product. Incineration is probably out, possibly some chemical contaminations in a very small scale. That might be an acceptable way of going. But And then when you look to landfills, they may not be willing or able to take contaminated carcasses or large numbers of carcasses. So it doesn't leave a lot of options. Burial and above ground burial could be good options. It depends on a lot of things. We saw the map of what they did in Michigan, and certainly site-specific analysis and matching that to the hazard would be absolutely critical. Composting might be useful. It does not degrade radionuclides. It may degrade some chemicals. There's been some studies that show that NSAIDs and pentobarbital do degrade with time in a composting process. It reduced the net water content and volume, and so it could be that you could compost, then bury, and maybe have less environmental issues down the road. But it's probably not going to be able to be used as a soil amendment unless you can show that the hazard is completely degraded. High-level waste, I just showed the one slide just because it's extremely expensive. There's a WIP site in New Mexico that takes high-level radioactive waste. It is not set up to take carcasses. Chemical, there are licensed sites in Michigan. They did the one site for burial of livestock. They had a second site at the county landfill that actually took the chemical contamination elements, in other words, feed that was identified as being contaminated and maybe some other things. And most likely we might see incident-specific sites. And Chernobyl, I think, is famous for the sheer amount of stuff that's buried at the Chernobyl site. They have entire vehicles, livestock, buildings that are basically torn down and buried from that incident. So there could be options for site-specific disposal sites. So as far as the critical elements, I want to summarize real quick, then we get to some questions. There were, I think, the interagency coordination guided by existing national plans is probably one of the biggest messages. It says the incidents are going to be complex, they're going to be challenging, but we just need to understand that there's mechanisms to work together, local, state, federal, and non-governmental partners in these type of incidents. And for USDA, it really means use of our capabilities and expertise to support that lead agency and to support state requests coming through that lead agency. It requires a One Health approach to integrating our capabilities and expertise into that incident. And we just need to be really working hard to collaborate with our public health and environmental health partners. It's going to take science and innovation. One thing I keep telling people is if we have a large radiological incident, we now have a living laboratory. This happened at Chernobyl, it happened at Fukushima, where you have this area that has to be monitored for not just years, but centuries. And so someone needs to manage that for the long term, and the opportunity for scientific investigation is really, really high. And the sheer volume of information that has come out of Chernobyl and Fukushima has been a really important thing for other nations to pay attention to, because what they've learned in these incidents would be critical to us should we find ourselves in their position. And last but not least, it's that risk communication, the ability to communicate to the public, to help demonstrate the science of response and give them a quantitative view of the hazard rather than a qualitative view of the hazard. In other words, radiation is not a 1950s science fiction movie. It is a very quantifiable risk There's radiation around us all the time. We're exposed to it every day. It's part of our own bodies. We just have to be able to quantify what the additional risk is from the incident and how to manage it effectively without really putting unreasonable and undue hardships on the public and the industry. So with that, I'll put up my contact information and be happy to work through any of the questions.
Okay, we do have a couple of comments first in the chat. In the case of radiation from Chernobyl, bone gelatin for X-ray film and gel capsules for medications were significantly impacted globally. Just a statement. And then the next one is in Wisconsin. I just lost it. About 11 years ago, there was an incident of ipomenol, I might not be saying that correctly, toxicity in cattle from moldy sweet potatoes that had been delivered to a local French fry manufacturing plant. This toxin caused several respiratory signs. Over 200 animals died at the farm. And there is a link in there if you want to look at that.
Yeah, I agree. It's just really important to look back at these past incidents because the history will probably tell us a lot about the potential future.
The next question is, I live and work in 3 Mile Island, EPZ. Which document do you reference for exposure limits of rad materials to livestock and poultry? Much of what I have is dated.
On the FDA's website, there's what's called the derived intervention levels, and those really are the official federal limits, and they're very similar to the international suggested limits for, and these are food limits, and so there's various equations that are used for various products. Because there's some things that don't absorb real well. There's other things like cesium-137 that absorb very, very quickly that have a short half-life. There's various types of radiation and differences in how much is absorbed. But the FDA-derived intervention levels is probably the key document as far as federal limits.
Okay, the next question is, in incidences like Chernobyl explosion, was the widespread to all those countries believed to be from the initial explosion, or was it through cross-contamination by human/animal vectors and water runoff causing spread in the soil?
Well, there was initial explosion, but the distinct difference between that type of reactor and most of the other reactors is the moderator in the Chernobyl reactor was graphite, and graphite burns. And so there was an explosion, but then the graphite continued to burn for many, many days. The plume from Chernobyl went up, tens of thousands of feet in the air, and that plume kept going for days and days and days. And so most of the contamination was from that initial explosion and then the intense fire in the graphite that happened afterwards. The thing about it is that in every radiological incident, you then get redistribution. And so at Fukushima, they had an issue of they were working on using zeolite filtration in the water in rice paddies to reduce the cesium content. But every time they would get a big rainstorm, the cesium would wash out of the soil from above and down into the lower elevation. So they actually had to develop drainage systems to keep the cesium from running down from the forest into the rice paddies in some areas. So I hope that answers the question. But there is redistribution. There's also transport within the food chain, within the environment, too. Just another quick one is they found in both Germany and Japan that wild boars who were rooting in the soil and eating certain fungi, those fungi were also cesium accumulators. And so the boars were much, much hotter than most of the other animals in the forest.
Okay. Do we have any other questions? I don't have any right now in the chat.
Well, that's good. We got 3 minutes left.
I know. Well, it said there's a comment. Wow, thank you so much. Nice job. That's great. We love to hear that.
Well, it's nice to see that Paul and some of the advisory team members are tuning in too.
Yeah. Lots of thanks for the presentation. While we're waiting to see if I think I have another question that came in. Thank you so much for your time and knowledge. I've definitely learned a lot and never realized just how impactful these chemical incidences are on not only the land, waters directly adjacent, but those even in other countries. Oh, there's some great comments. Great stuff. Have to keep you honest. We like that. So before we close today, I just want to thank everybody for their participation and to let you know we have another webinar next week on Thursday, May 27th at 1 o'clock Eastern Standard Time. Dr. Leslie Serafin will be our speaker, and the topic is swine brucellosis alternative surveillance, protecting human and animal health. And we are scheduling additional webinars for June, so please watch your email. Oh, and there's one more comment. 3 Mile Island. Wow, I lived in Pennsylvania for years. I was born and raised there. With 3 Mile Island powering down, how long will they have to monitor the radiation levels around the area? Interesting.
That's a complex question, but it depends on if they keep the spent fuel there or if they move it off-site. But it takes a long time to remove one of those.
And then someone else made a comment, 3 Mile Island is now shut down and will be monitored for the next 50 years. Wow. Oh, because spent fuel is still on site. Wow.
Yeah, and I've been inside there, and I mean, the thing that most people don't realize is just how big those structures are.
Interesting. All right. And with that, thank you again, Dr. Dennison, for this presentation. It was very interesting. And I'd like to bid you all a happy afternoon. Take care, everyone.